Well, this study was named like Percutanius repair of medical treatment for secondary mitral regurgitation. First of all, we divided this study in three steps. The first step was the method. The methods were also divided in four steps, but first we are going to tell the preliminary part. We evaluated 252 patients who had acute mitral bleeding within 18 hours after administration of a factor Xa inhibitor. Then, the first step of this method were the study design and oversight. This was multi-center prospective open-label single-group study. The Population Health Research Institute, PHR at McMaster University, at the industry-sponsored Portugal Pharmaceutical joining the silent study, and both selected sites as supervised monitoring. Then we have the next step that was the study population. The study population in the patients were enrolled at 763 centers in North America and Europe. Patients were eligible if they were at least 18 years of age, presented with acute mitral bleeding, and had received within 18 hours one of the following application. The next step was the study procedures and data collection. This consists in that the eligible consenting patient receive an andexanet bolus over a period of 15 to 30 minutes, followed by 2 hours infusion of the drug. The following doses were used in the initial protocol for all patients who had received a apixaban and those who had received rivaroxaban more than 7 hours before bolus administration. The next step was the study outcomes. Study outcomes consist in that the study had two primary efficacy outcomes: the percent patients from baseline in active factor Xa activity after andexanet treatment, and the percentage of patients with an excellent or good hemostatic efficacy 12 hours after andexanet infusion, with hemostatic efficacy assessed by an independent adjudication committee of the basis perspective criteria. Then we have the results. The results were divided in three steps, but first we are going to tell the preliminary results. The patient had mean of 77 years and most have substantial cardiovascular diseases. Bleeding was predominantly intracranial in 227 patients, that was receiving the 64% of the study, or gastrointestinal in 90 patients, that was the 26%. In patients who had received apixaban, the median anti-factor Xa inhibitor decreases from 149.7 mg per milliliter at baseline to 11.1 mg per milliliter after andexanet bolus. The first step was the patient. We enrolled 352 patients from April 2015 through May 2018, including the 67th patient reported previously. All the patients received andexanet and were followed for at least 30 days or until the patients had a mean age of 72. Patients' baseline medical history included myocardial infarction in 48 patients. The next step was the anti-factor Xa activity in the efficacy population among the 132 patients who were receiving apixaban. The median value for anti-factor Xa activity was reduced from 149.7 mg per milliliter at baseline to 11.1 per milliliter at the end of the bolus administration. The next step was the hemostatic efficacy. Of the 252 patients in the efficacy analysis, 249 could be evaluated for hemostatic efficacy and 204 were adjudicated at having excellent good hemostatic efficacy at 12 hours. Of these, 171 were adjudicated as having excellent hemostatic efficacy and 33 as having good hemostatic efficacy. And finally, we had the conclusions. The conclusions were that in patients with acute mitral bleeding associated with the use of the factor Xa inhibitor treatment with andexanet markedly reduced anti-factor Xa activity at 82% of patients had an excellent or good hemostatic efficacy at 12 hours as applied according to the perspective criteria. Finally, we have the videos to have a better comprehension of the study.
some very interesting research is being done in terms of developing an antidote to the new generation of oral factor XA inhibitors. And whilst none of these are yet available, it's probably one of the most interesting, closely watched areas in CV research right now. So we're going to talk about a study that's being presented at ASH, I think. There's some other research that's been presented also at the International Society on Thrombosis and Hemostasis, and I am with Dr. John T. Carnute, who is MD, PhD, and Executive Vice President in Research and Development. And what are we talking about in terms of what's exciting right now?
Well, what's exciting is the antidote, which is known as andexanet alpha, is in phase 2 studies, and what we've seen is that it is a very potent and rapidly acting intravenous reversal agent for all of the 10A inhibitors. We tested it with rivaroxaban, with apixaban, with enoxaparin, and it is a exciting new data. Hopefully will be presented. We just submitted an abstract with our Bristol Myers and Pfizer colleagues on apixaban showing